Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, some of the highlights. Today, Nigeria records more cases of coronavirus in the last 24 hours, 16 deaths and 571 new cases. Medical doctors employed by Lagos State government begin a 3-day warning strike over issues of workers' welfare. And more than 230,000 coronavirus cases recorded globally in a single day, according to the World Health Organization. Most new cases in the Americas, followed by Southeast Asia. 344 patients have been discharged from various treatment centers across the country in the last 24 hours after the Nigeria Center for Disease Control (NCDC) recorded 571 new infections, 16 deaths across the country. The new infections were recorded in 19 states of the Federation and the Federal Capital Territory, with Lagos having the highest figures of 152 cases, followed by Ebonyi in the southeast with 108. The total confirmed cases in the country stands at 32,558, total recoveries at 13,447, and the death toll is at 740. Total testing so far across the country is put at 181,248. For the bottom 5 states with less than 5 active cases, Zamfara and Kogi states still have 0 confirmed cases being managed at the treatment centers, while Yobe, Bauchi have 3 cases each. Sokoto and Jigawa states have 2 cases each, and Cross River State has 5 active cases. Now, a number of states, the state governments that is, they've commended traders at the popular Eke-Awka markets in the state for showing total commitment towards observing the COVID-19 protocols in order to prevent the spread of the virus. The Commissioner for Trade and Commerce, Mr. Uchenna Okafor, said this following the reopening of the market after it was shut down by the state governments due to poor observance to the safety protocols for COVID-19 on market reopening.
In Anambra State, we have a structure. Because ever before now, we've been treating market leaders or market union as another arm of government, like we also do for town unions. We trained like 40 task force members in all the markets in Anambra State. They were advised and trained on how to enforce total compliance to COVID-19 rules, and that was done. Within the first month, it was so successful, but after 1 month, we at the state, our monitoring team noticed that some markets started drilling, precisely Eke-Awka here, and His Excellency closed down Eke-Awka for that reason for 2 weeks. And they reopened on Monday. After they were retrained again, because after the closure, we have to retrain them and add more men to their task force. Then today, I came unannounced to check the level of compliance, because the rule in Anambra State is that in any market I visit unannounced and notice that the level of compliance was low, and if they are not doing the right thing, the market will be closed.
Over in Plateau, 533 confirmed cases of COVID-19 has been recorded so far in the state, with over 8,000 people that have been tested for the virus, while 1,661 test samples are awaiting results. The Plateau State Commissioner for Health told Channels Television that 16 deaths have been recorded, with 244 persons discharged from various treatment centers in the state. According to Dr. Nimkong Indam, he says the major challenge facing the task force in the state is the shortage of testing kits, what it believes will assist in rapidly conducting more tests in the state. It also says that members of the task force have been on the trail of those that have come in contact with confirmed cases in terms of contact tracing, which also appears to be a Herculean task for the committee, as well as the non-adherence to government directives on using the face masks.
We have tested 8,546 persons, citizens of Plateau State. Out of this number, we have been able to receive results of 6,847. And we have pending results that we have not been able to receive yet, still in the lab, 1,661. Yesterday, we recorded 17 confirmed cases. And so, presently, we have a total of 533 persons that are confirmed cases on the plateau. 533. Out of this number, we have been able to discharge 244. So we have quite a number on the treatment now, and we lost 16 persons so far.
Plateau State Commissioner there on the update of the COVID-19 case situation in the state. Well, the World Health Organization has acknowledged there is emerging evidence that the coronavirus can be spread by tiny particles suspended in the air. According to the health body, the airborne transmission could not be ruled out in crowded, closed or poorly ventilated settings. Well, we have Dr. Adishina Dega, Head of Research at Mountaintop University. He joins us to analyze this. We'd like to thank you for joining us on the program. But I'd like to first begin with some of the cases we're getting. It's still a daily rise, so the curve is still upwards. We haven't reached our peak yet. Several state governments, health commissioners, they're trying to be on top of the situation in terms of fighting the spread. But one thing appears to be a challenge, and other than what the Plateau State Health Commissioner said, that is contact tracing. It seems to be the same for a few other states across the country.
Yeah, contact tracing is difficult in a setting because there's no so much of public health education. Public education to be done in form of campaign, as if you are campaigning for vaccination or exactly campaigning for election. So, and that's when they get the message. But now everybody's just taking it with levity. That's one. Number two is that because of not challenge about the situation, they don't put on the face mask, then they go to the market, they enter buses without it. And then with that, even the symptomless, people that are now without symptoms can easily spread. How do they spread? When they talk, anytime you talk, then you emit particles from the mouth in form of either water droplets or that can contain virus or bacteria. Then with that, it can stay on the face, it can stay on the cheek, can stay on your hands, and then you rubbing it can also, so you cannot touch any part of it. And with that, you can even inhale when you are not protecting yourself. Apart from that, the time they stay with the contact people, the infected people, is also high. It's long. And once it's long, the virus has all the time to enter the body through inhalation or through contact through the eyes or whatever. And from there, it multiplies.
So essentially, with this explanation, there is the question, is it airborne?
Of course, yes.
Conclusively?
Of course, yes. It is airborne, and it's even with the kind of precautions given. Common sense tells us that it's airborne. Because they said put on the face mask so that your blood pressure will not...
So it stays in the air for how many hours? And then on surfaces, how many hours?
Well, it depends. It depends on the situation. If the environment is conducive, it can stay for long hours, more than 24 hours. And then, but if the environment is not conducive, like high temperature, then it can just be for an hour or less than an hour. It can so. But then the most important thing is that preventing ourselves and then also dispelling the air. You know, for instance, in this environment now, if we are talking and I'm talking and have virus, it's aircon.
Yeah, so this is a studio. And
this
because
is studio.
Of the noise.
Fine. Here, if you want to prevent anything, you have to get a kind of air filtration. Okay. If there's air filtration, you're okay. Then at any point in time, there's nobody inside the studio, You can also set up a sanitizer, ultraviolet rays. All you need to do is just put it on. It will destroy any pathogen. And then after some time, you put it off, and then people can come in. So these are simple measures. However, how can that one be affected outside? It can be affected by government, either state government or local government, taking it upon themselves to disinfect the environment. The Lagos State has started that some time ago, disinfecting the market and all that, but they've stopped. Apart from that, how many communities would they go to? So this is our responsibility of local government and also even at the wards. So there's a need for us to really redesign the method of IPC, infection prevention control. If there's a strategy about it, then you can now design the mechanism. And when the mechanism is built, then everything will be okay. But then, and most importantly, is that enforce face masking and social distancing.
All right. Some people are saying that the World Health Organization should have made these acknowledgements sooner. When it was about face masks, they waited quite a while, but they still say that it's for medical personnel.
No. As I'm explaining to you now, WHO is saying that the aerosol kind of transmission is taking place between the doctor and the patient and all because of the close contact. Why? Are they comparing that with a market space contact? Are they comparing that with the bus driver passenger contact, which people go through daily, every day? So if that market scenario and transportation scenario are similar or identical with that of medical officers stroke patient scenario, then the measures taken to control that of hospital care should also be implemented.
All right, since we have symptomatic and asymptomatic carriers.
Exactly.
We appreciate your time. Thank you so much, Dr. Adesina Adega, Head Research, Mountaintop University. Thank you for joining us on the program.
Thank you for having me.
Now, the Medical Guild, an association of medical doctors employed by the Lagos State government, we hear they've begun the 3-day warning strike over issues of workers' welfare. According to the chairman of the Guild, the strike will run from today, Monday, to July 16th, but would exempt members working in the state's COVID-19 isolation center. The Guild had on June 27th extended a 2-week ultimatum to the state government after the expiration of its initial 21 days deadline to resolve some of the issues. We have the chairman of the Guild, Dr. Oluwajimi Sodipo. He joins us via Skype here in Lagos. Thank you for joining us on the program. So there seems to be a lot of grace periods for the Lagos State government. But what responses have you been getting?
Okay, thank you very much for this opportunity. As you mentioned, the action started this morning, but yesterday, Sunday, we had a meeting with some top government officials, including the Commissioner of Establishments, Commissioner of Health, and the Head of Service, to discuss a number of the issues. And the plan right now is to try to get the information that we've got from them to our members and update them on the situation so far. We also appreciate the intervention of the First Lady of the state. And of course, Mr. Governor too has also intervened to explain that some of the challenges raised will receive necessary attention. And we have a protocol for passing on this information to members, and we have activated that. And we hope that we have a speedy resolution within the soonest possible time.
All right, we're going to take a break now and come back to ask you our final question with regards to this warning strike. Of course, do stay with us. We still have more on the COVID-19 updates when we return. Welcome back, and we've been talking to Dr. Oluwajimi Sodipo, Chairman of the Medical Guild, Association of Medical Doctors employed by the Lagos State government. Thank you for staying on with us. So I'd like to ask the final question, and this is, you said that you want government to meet at least 70% of the demands. What is the one thing the Lagos State government must do? And this is before you call off further actions, because you said in the past that it's really not about money alone So what exactly do you want the Lagos State government to do?
Okay, yes, thank you. I guess the question, if I got it correctly, is what is the one thing? Well, our major concern truly has to do with ensuring that the welfare of the members are looked into so that the members could actually look after the public, which is our primary responsibility. We take this issue with all the seriousness that it deserves. And that was why the decision that was taken took into consideration the fact that we might not be able to achieve everything that we want. But the most important thing is that we start these discussions, we keep the discussions going. I think the challenge that we had was somewhere along the line, there was a break in communication because following the first ultimatum, the reason why it was extended was to give an ability for all parties to meet and keep on meeting because the challenges are unfolding. So we've started the discussions. I wouldn't want to mention any specific thing here, but anything that would have to cater for the welfare of the medical doctors, other healthcare workers, and of course, in generality, the citizens is what we are looking out for. And we just hope that, as I said, within the shortest possible time, we could have a peaceful resolution to this and a permanent one. And we go back to what we are used to doing, which is saving lives. Thank you.
We appreciate your time. Dr. Oluwajimi Sodipo, Chairman of the Medical Guild Association. Thank you for joining us on the program.
Thank you for having me. Thank you.
Its most common symptoms of COVID-19 are a fever, coughing, breathing problems, and many others. Some doctors say rarely it also can cause an eye infection called conjunctivitis, which they believe 1% to 3% of people with COVID-19 will get. Also, another study in JAMA Ophthalmology found that 31.6% of 38 consecutive patients with COVID-19 seen at a hospital in Hubei province, China, had eye-related symptoms like eye inflammation, swelling of the conjunctiva, and a few others. We have in the studio an ophthalmologist, Dr. Chinedu Okeke. He joins us on the program. Thank you for joining us today.
Thank you for having me.
All right, so how does COVID-19 affect the eye?
Okay, before we start talking about how COVID-19 affects the eye, we need to talk about the mode of transmission of COVID-19. We know that COVID-19 is a very infectious organism, and it enters into the body through the mucous membranes, which we have in your mouth, in your nose, and also in your eye. The white part of the eye is actually covered by a mucous membrane called the conjunctiva. So the mode of transmission is mainly through the respiratory droplet infection, which can get into the eyes. Now, when someone also touches an infected surface and inoculates directly, meaning puts your hands into the eyes, into the nose, onto the mouth, one can also get infected with the virus. Commonly, COVID-19 causes fever and other symptoms you have mentioned, but in the eye, it causes an inflammation of the eye called conjunctivitis, which people can also call red eyes. Then some people also present with things like pains in the eyes, tearing, and excessive secretion. But the most common symptom of COVID-19 in the eye is red eyes, which we call conjunctivitis.
Does it affect adults differently, children differently?
No.
Because we know children are prone to getting conjunctivitis every now and again.
Yes. Well, I must also say that conjunctivitis from COVID-19 is not very common. Other symptoms like fever and cough are much more common. But as you rightly said, about 1 to 3% of people come down with conjunctivitis, whether in adults or in children. And the particular type of conjunctivitis it causes is called a follicular conjunctivitis, which can also be caused by other viruses. So red eye, we know, is a common symptom of viral infection, but studies have also shown that COVID-19, being a virus, can also cause conjunctivitis.
So if there's a possibility with the eye being infected, respiratory droplets, shouldn't that mean we should be wearing glasses, face shields, and the face mask?
Yes.
rather than just the face mask, which covers the nose and the mouth.
Yes. So the major means of transmission is actually through inhalation of the respiratory droplets. But a certain percentage has shown that when an infected individual sneezes and the respiratory droplets get into the conjunctiva, into the eye, one can also get infected by coronavirus. So people at risk of being infected, especially the health workers, people that come in contact with infected individuals, should also wear protective goggles, glasses, eye covers, because apart from covering your nose and your mouth, you should also protect your eyes, because that way you can prevent infection with the virus.
And that would also include yourself when handling patients.
Yes.
We appreciate your time. Thank you so much, Dr. Chinedu Okeke. Thank you for joining us on the program.
It's a pleasure.
According to the World Health Organization, the total number of coronavirus cases across the world has risen by more than 230,000, a new daily record. Majority of those cases and over 5,000 deaths recorded are from countries in the North, South America, with the US alone recording over 66,000 infections.
Australian scientists have begun human trial of a potential COVID-19 vaccine developed at the University of Queensland. Volunteers have received the first vaccine dose. Preliminary results of the trial are expected to be released by the end of September. The regional government of Catalonia, Spain, has decided to reimpose lockdown measures beginning on July 13 in the city of Lleida and 7 other areas due to surging COVID-19 cases. The decision came following the recent outbreak in some parts of the country. The Chinese Health Authority said it has received reports of 8 new confirmed cases on the Chinese mainland and that all of them were imported. Of the 8 imported cases, 4 were reported in the Inner Mongolia Autonomous Region, 2 in Guangdong Province, 1 in Shanghai, and 1 in Shandong Province. Rio de Janeiro's Mayor Marcelo Crivella ramped up public health supervision as beaches, malls and popular venues were allowed to reopen to help restart the economy, even though COVID-19 has claimed 11,400 lives in the city. Residents were also allowed to go to public squares and pedestrian streets on the weekends for leisure activities, and Rio Olympic Village, cultural and art venues have also opened.
From the Nigeria Center for Disease Control, do not use a face shield without a face mask. A face shield alone cannot prevent the spread of infectious diseases like COVID-19. Always wear a mask. Remember to practice frequent hand washing, respiratory hygiene, physical distancing for adequate protection. Their website has regular updates on the coronavirus pandemic in Nigeria across the state. From the World Health Organization's website, your questions are answered on the disease situation, the latest global numbers, and of course, the numbers by country of COVID-19 cases on a daily basis. You can see all the graph, the information, regions, continents across the world. Our website, channelstv.com, has the latest news. All you need to do is log on, access news in health, politics, business, sports, Africa, and the rest of the world. All at your fingertips, channelstv.com. That's the COVID-19 update. Thank you for watching. I'm Minister Ntunwoka. Bye for now.